And we are live. Okay, good morning. This is Senate Health and Welfare, and it is January 10th, 2025. Happy New Year. We're all here. And just welcome everyone. It's a new year. We've got a lot to do. So before I start talking about where we are and who we are and what we're going to think about, I thought it'd be great just to introduce ourselves and say a little bit about who you are and what your thoughts are, any thoughts you might have about your background related to health and welfare, if any. It doesn't have to be long, but short, just a minute or two would be great. And so who would like to start?
I can
I'll
start.
start with Vice Chair.
Thank you. My name is Martine Larock-Kulik. I represent Chittenden Central, which is Burlington, Winooski, Essex Junction, a little bit of Colchester, so it's a pretty big swath. I was clerk of health and welfare for the last 2 years, and I enjoyed my work here very much. I learned a lot, and am happy to be continuing my learning because, as you all know, healthcare policy is complex, and once you get going with it, you don't want to, at least I'm feeling like I don't want to just give it up. And it's also so incredibly important. So I'm happy to be here, and thank you very much. Nice to meet all of you.
I'm Ann Cummings. I think Ginny and I are the seniors in this building
We
at
are.
this point, at
Yeah.
least in longevity. I've been here since 1997. I represent Washington District now, which includes Washington County, Stowe, Braintree, and Orange. So it's a pretty big and diverse. I've got ski areas, I've got some industrial towns, and I've got farms and small towns. So it's a pretty diverse area to represent. I've chaired finance for many years. I think this is at least my third, maybe my fourth pass through on this committee. I've served here several times. I was actively involved. The finance committee finance has jurisdiction over health insurance. We have insurance broadly, and health insurance is in there. So I was actively involved when we were trying to develop a single payer plan. Anything that we do that will impact health insurance in this committee goes to finance. Anything we do that spends money goes to appropriations. And so we've been working on for a number of years to keep that line of communications going, so that I know last year there were several bills came over from the House with at least one came here with a tax attached. And
Right.
we were told, I told people, don't assume that tax is going to make it through when you're doing the bill. And it did. So that's pretty much what we do.
And I'm in the afternoon. I'm in finance with Senator Cummings too, just FYI. So you've got me all together. I know. We're gonna be spending a lot of time together.
Too much.
Usually last year, Senator Brock and I were together all day. The Secretary of the Senate and I were together all day, along with former Senator Aluzzi. My first year here, there were like a pack of us that traveled from judiciary to institutions every day. Cool.
I'm actually happy I don't have that, so I get to see more people.
Yeah.
Go ahead, Sam, you're up.
Oh, sure. I'm Sam Douglas from Orleans County, representing 20 towns, good number of which are not in Orleans County. I currently work as a crisis intervention specialist and a suicide counselor for Lamoille County Mental Health about 4 days a week. So yeah,
I may need to pick your brain.
please do.
He's going to be very valuable to us.
Oh, yes.
Yes, he is.
How did I miss you on finance?
Good. Thanks.
I'm Larry Hart from Orange County. I represent Possum Springs, Bradford, Beverly, Westville, Berkshire, Stratford, Tunbridge, Chelsea, Washington, Williamstown, Brookfield, and Randolph. It's one big. There are three towns in Orange County that I don't represent. Newberry went to Caledonia County, Thetford went to Windsor County, and Braintree went to Addison County.
Now Braintree is mine,
Braintree's yours now?
right? Yeah.
Okay, then they must have given it to Washington County instead.
Yes.
Originally, they.
It was going to be, it was Addison. We have a road. One of the criteria is there has to be a road that goes there. And you can do 12A to Braintree,
You can, right through Roxbury.
and Roxbury is in Washington County.
What was the one that Sarah Cattell used to have to get to that was really over the mountain?
Oh, there was one Gore.
Yeah,
I think.
and she said, no, please don't get me that.
It gets a
I,
little strange.
I've done sales for my whole life, but after losing my daughter to opiates, I became a recovery coach and a health coach. So, a life coach as well. So I help people with whatever. Now I'm a sober coach. So if anyone comes to me, I talk to them about that. So the addiction thing is a key part for me, helping people through addiction or helping them hopefully survive addiction.
Terrific.
That's what
We've got the world covered here. This is great. Yeah.
That's what my view is.
I like it.
Yeah.
Yeah.
Well, wow, that's great.
It is.
What a good group. So I'll just introduce myself, for the record, Ginny Lyons, and my Senate district is Chittenden Southeast. Until 2 sessions ago, I represented all of Chittenden County, which is a heavy lift. It's like, I forget how many voters that people that represented 140,000 or something. Now it's down to a manageable 70 something thousand. But all the ring towns around Burlington, so it's a very rural district in many respects, and then part of Burlington, the south part of Burlington. And while I used to represent the hospital and the university, I no longer do that, but certainly a number of folks who work in those places are my constituents. My background has a lot to do with healthcare and among other things. And I've been chair of this committee for a while now. I did chair natural resources, which is also a big part of it. And we have some of the most challenging issues in the state before us, beginning with recovery issues, substance use disorder, and all the community services necessary to support folks. We also need to be looking at acute care and how we can maintain our hospitals and our insurance companies, all in dire straits. Our federally qualified health centers are in dire straits. It's not a good scene out there. Having said that, I think I'm so optimistic about working with you all. I think we're going to be able to make some positive change, and we'll be working with folks who will come in and help us testify to that. So, what I wanted to do this morning, and it's not going to take long. It'll be great if we can get into, we'll get into a conversation in a little while about your expectations. And I think we'll really on Tuesday, I anticipate having a longer conversation about what you would like to work on, what your interests are in health and welfare. Give the weekend just to go through and think. We might have bills coming in, we might not. So we'll do that next week. Today, I thought it would be helpful just to put some procedural things on the table for you to understand how we function in here. We're a small committee. We got lots of people coming in. There are huge ideas to discuss. And one of the difficult things that we do is to maintain some kind of order so we can all have an opportunity to ask questions. At some point, we have discussion and that everyone is heard. So, and I'm getting over my cold, and that's the good news. It's not been a good week. So just to set the table a little bit, while we're in committee and we're on live, it's important that we address each other as senator. We've done that in the past. We forget it, but we become friends, so it's hard to remember, senator. If you would like to raise a question or ask a question of a witness, or you have a question about information, or you want to offer something, when we have witnesses in the chair or we're in discussion, just raise your hand, and that's important. Otherwise, we collide at the intersection. So that's really important. The most important thing for me is to please be on time. We're going to start at 9 o'clock. Other committees start earlier. And if we miss that 9 o'clock and we get to be a little late, then we might start at 8:30. We don't want it. Did we ever have to do that?
No,
I don't think we were going to do that. That's what maybe.
We started it, maybe that was under Claire.
Yeah.
We started.
Oh, she started at 8.
Right.
No,
8:03.
no, I couldn't do that. But so 9 o'clock is good. And if we get a lot done, we will get a lot done. If we have to start at 8:30 as the session goes on to finish up a bill, we'll do that. And then if we need to move to 8, we can do that as well. But 9 o'clock.
Madam Chair, I just wrote down 9 o'clock on Tuesday. Is that correct?
Every day that we meet.
It's like every day, so it'll be Tuesday. I know.
Yeah,
No.
well, Tuesday we'll announce on the floor. Tuesday, so remember, we have floor times and we'll start at 9:30 on Tuesday.
Okay,
So then I'll just announce on the floor after the session will meet. But Wednesday, Thursday, Friday, we start at 9, right? And then the floor is afternoon on Wednesday and Thursday and 11:30 on Friday.
and I hope you don't mind, I call you Madam Chair.
No, you don't, that's fine. Fine. I guess people do that. That's good. So, yeah, and thank you for that, actually, because that's a good point to be made. It's important to respect the chair. I don't have all the answers. I don't have all the ideas. I will set the agenda, but the agenda will be based on the bills that we have on the wall and the interests we have in the committee. And I will have my own goals, and I'll tell you about that today a little bit, and then on Tuesday. And so we'll have an agenda planning meeting every Wednesday, and I'll meet with our ledge council, and I invite the vice chair to come into that meeting. And it's not a secret; it just takes time to get it done and work with Kiki. And so, before I go any further, I want Kiki to introduce herself.
Hello, my name is Kiki Karasi Schwartz. I stopped the Health and Welfare last session. I'm excited to be back. It's my first biennium, so things are still new, but ever so happy to be back in the building. Look forward to working with you all.
And if you need something, ask Kiki. She's not your assistant, but she is our assistant. And so if you need something, she can be very helpful, and she'll let you know if it's not in her work responsibilities, but glad to do that. Right?
Correct.
Okay. So the committee process, we don't have a lot of time to do everything we have to do. I mean, think about the committees in the House, which are House Human Services and House Healthcare, work on the topics we work on, but they work all day. They meet all day. And we have 2 committees that send us bills. So we work a short period of time when they're taking a lot of time over there. So the time that we have is very precious. And I just remember that. That's all. So when you get into the mode of wanting to give a speech about something, think twice about doing that. I may cut you off if you start getting going too far. But if you have something important to say, you should, definitely do that. Raise your hand. And so I don't know anything more to share at this point, except to say the work will get intense and we'll just try to stay as a team and work together. We will bring very different perspectives. Witnesses will bring different perspectives, but it's absolutely important to collaborate and to get to a place where we can support the work that we're doing. I feel comfortable that we'll be able to do that. When it gets to finance, and we talk about sending a bill down the hall that has a lot of money in it, or to appropriations that has a lot of money in it, that's a difficult thing to do. And especially this year. I don't know that we're gonna have too many of those bills. I don't know. So the work that we do is based on the reports that we get back, that we've asked for reports. It's based on the witnesses we have in, like from the administration, from citizens. Your constituents may want to testify on a bill or an issue. That's important. If you have someone you want to testify, let me know. We'll try to fit as many folks in as we can. Because hearing from real Vermonters is the real deal. At the same time, we want to make sure that we have enough information from the regulators, whether it's the Green Mountain Care Board or the Agency of Human Services, that we'll be able to put their testimony into context. And then we have, we'll meet the healthcare advocate who's sitting in the room today, who has a great deal to do with representing the people of Vermont in the healthcare environment. So we'll be able to hear from him, and he collects all that information and brings it to us. So when we hear from constituents, it fills gaps. So that the way we get our information is just by listening and by reading reports and by having experts in. But the most important thing is that we have staff, and we have some very highly qualified staff. We're going to meet them on Tuesday, but we have one of them with us today. And do you want to come up and introduce yourself, Nolan?
Sure, I didn't do that too, but
Yeah, that's right.
when I sit here, I'll usually start off with, for the record,
Yes.
Nolan Langwell, Joint Fiscal Office. And you'll meet Katie and Jen next week, and we joke around, they're the words, I'm the numbers. But we are a team. I cover pretty much all health and human services related stuff. We service the House and the Senate. So I speak for myself, not the lawyer. I will staff 11 committees, depending on where the issue is, where the bill is. If you pass a bill that has money, I will follow the bill and help explain the money to all the various committees that fill this. This is my 18th legislative session here for Joint Fiscal. Yeah, I feel like part of my charge is to help give you all the information, data, knowledge, whatever it is you need to help make the best informed decision you can. So I'll be in here a lot next week, doing a lot of healthcare high-level 101s, health insurance 101, Medicaid 101 to help folks understand stuff. But also I'm happy to work with anyone individually, particularly you folks, to help. You'll hear me say this, and I'm going to say it again and again, especially when we start talking about Medicaid. If you don't get it the first time, it's not you. If you don't get it the second time, it's not you. Or if you don't get it the third time, it's still not you. This stuff is really, really, really complicated. The formulas and the calculations of what gets covered and how much of it gets covered is all determined by the federal government. And it's just how waivers work. It's complicated stuff. And so I don't want anyone to ever feel overwhelmed when I come in and start talking about something called political commitment, which is a very, very important piece of our Medicaid program. There's people who've been here for years and years and years and still don't completely grasp it because it's very complicated. And especially being in the Senate, you only have half a day and you have two subjects. So health and human services, where the House, they have all day on each of those subjects. There's a health committee and a human services committee, and they spend all day. And those both issues come here to you in about half a day. So,
That's why we have that little bumper sticker.
yeah.
It's more complicated than that.
So my job, in addition
It's still
to,
there.
right,
It is.
been there since single payer.
Yeah, it has.
So in addition to providing the fiscal, analysis piece, I have to like, you need the tool, my job is to help you understand this stuff. So,
You want a fiscal note, maybe you could explain
Sure.
what that is.
fiscal note is, when a bill is moving. So there's over 1,000 bills, I think, that have been introduced over a biennium. We do not do fiscal notes on every single bill. We will do a fiscal note on a bill that is moving in committee. And what that is basically it's a document that basically explains the various components of the bill and the potential fiscal impact of the state funds on those bills. So if a bill passes out of a committee that has any appropriation, fee, tax, etc., it needs to have a fiscal note, and we'll draft a fiscal note and we'll share it with you guys. Often the fiscal note might not happen until after you pass it, and then I make the fiscal note and then I take it to the committee. But if it's one of your bills that you care about, I'll make sure you get a copy of it. And I try to sort of say, this is how many people it will impact. This is how much general fund, this is how much federal funds. I try to do that to the best of my ability. But we don't do fiscal notes on every bill.
Questions for Nolan? Question. You'll get to know Nolan next week. He's gonna be in sharing a lot of information with us. Great.
Yeah, so don't be afraid to have questions, or I explain something and you didn't quite have an opportunity to ask the question in committee. Always happy to sit down with folks, particularly I said, people who are legislators that are here for the first time. Because it's in everyone's interest for you guys to understand the stuff the best you can. I feel like it's my job to help get you.
I have a quick question. When do we get the 2025 numbers?
They often don't come out till like February.
Okay.
So they haven't been updated yet. But trust me, when it's out,
We'll get
Ginny
it.
will send her line, sorry.
We'll get it.
We'll get there, we'll
Thank
have
you.
it posted on the wall.
Well, maybe we can cover up 22,
Yeah.
23, I don't need that.
Probably take it out, take it
Yeah.
down. And I can also make sure each of you just get like a little pocket copy.
Do you want to explain what that is, or are you gonna do that next week?
Well, I can explain it briefly. What
Yeah.
the federal poverty level is, it's a number determined by the federal government that is, I can't explain specifically how it's calculated, but it's basically the calculation or the number that's used for how eligibility is determined on a lot of federal programs. So the sense that if you're in poverty, you're at less than 100% of federal poverty, which obviously you can argue 200%, 300%, depending on your situation. But a lot of the different programs might be, it helps people, the eligibility up to 133% of federal poverty, 138% of federal poverty level, 214% of the federal poverty level. And they might be weird numbers because they were 100, 200, 250, and then over time they just sort of incremented by, we're going to do a 3% increase, in real dollars. But this also helps because a lot of times I'll be like, okay, we're talking about reach up, we're talking about Medicaid. I might say, it's someone with 133% of the federal poverty level. You're like, wait, what's the income? Because to you that means nothing. But you can look and try and say, someone who makes under $28,000 a year or something. So that's what that chart is.
So if you look at that just briefly, because we'll look at it at some point, a household size of one at 100% of poverty, that's $15,000 a year. So if you're going to be eligible for Medicaid, what is it, 138%?
Yeah, right now.
Yeah, so anyone who's earning $20,000 a year is eligible for Medicaid, 20,000 below. So that's how it's used. That's the eligibility.
And the reason it's going up to 1,000% in that chart, because during last year's 2 years ago's conversations around childcare subsidy, we were looking at scenarios that went as high as 700% of federal poverty level, which had a slight curve.
It's like $2 at the top.
Yeah, it comes a point where it's a curve. The other thing I will tout which I always find helpful, is and I'm putting Mike on the spot, but is their chart that they put together, the eligibility of all the different programs that has.
Oh, yeah.
FPLs.
Well, we'll have him bring that in. That's a good idea.
Yeah, I love it.
Yeah.
It's very helpful. And
I don't have one.
it's also.
I've
it's
got it
retro and
somewhere.
outdated. But it's a useful chart. It's all the healthcare Medicaid programs and what the eligibilities are. And usually with the Medicaid, and I'm getting ahead of myself, there's often two doors to get into Medicaid. It's a poverty level and a disability. So you might be someone with a higher income, but you have a severe disability, you might still be eligible. And then some of them are age as well. So you'll see there's a lot, you and I have talked a little bit about this, but you'll see there's a lot of different doors, people to get to the different programs, but there's so many different programs and they all have different doors. And so I'm in the process trying to put together something to clarify that after a conversation I had with Senator Douglas, which that's a lot harder than you think, or it's a lot harder than you expect. But sorry, no, that's okay. It's a good project.
Well, it's interesting because when we talked on the phone, you said the one thing I feel less assured about is the financial piece, but now you're finding out about it. That's great. Yeah.
Well, it's confusing because the state and the federal government have a lot of different programs for different things. They all have different eligibility. They have different agencies that administer them. They try to have like a single door at DCF where you can come in, but it's still not, it's easy to decipher from trying to look at it from a holistic approach. From a consumer approach, it's a lot easier because you just go in and you fill out the paperwork and they say, okay, you're on the list, this, great. But when we're trying to understand that in May pocket, it's a lot harder. So it's a good project for me. It might take a little longer than I thought.
Cool. That'll help all of us. That's great. Good. Thank you. All right. Any other questions? Good questions. So when we hear from you next week, we'll have lots of questions. I know. Good. Thank you. And next week on Tuesday, we'll also meet our Ledge Council lawyer staff, Jen Carvey and Katie McClin. They're our principal lawyers. And then be able to talk about what they do, how they help us. So we need all of it. So honestly, what questions have you got about how we operate or what, how you get information at this point? We got two old hands here.
Senator Lyons, I feel like because I am a rookie at this, that my biggest deal is just to listen, take notes, and ask the questions when necessary.
Good.
Okay.
We're all rookies. We'll all be doing that. It's good.
Yeah, I was glad to hear you are doing 101 because I was going to ask for that. Because as you go through, when you've got One Care and this and that, and there's all these programs we've set up, all basically trying to control cost and improve quality. It gets complicated and yeah, it's always good to have a refresher course as to what is that when the name's getting thrown out.
So that's exactly what we're doing. We're going to have healthcare 101 from Nolan, and we're going to have Medicaid 101 from Nolan, maybe a little bit more. So that'll be very useful. And then we'll hear from the healthcare advocate who will add into that. It'll be lots of fun.
It'll be my first year here, we did electric restructuring. And my mantra was, I learned municipal sludge, I can learn this. And eventually you too.
Sorry, no, what's your last name, Noel?
Cummings.
Oh, my last name? Langwild. I can give you a card.
And it's no one,
No, I'll give you a card.
Senator, questions?
Thank you.
Comments? You're all set? Okay, you've already started getting information for us, for yourself, but we're gonna grab it too. So, and I just share with you, I don't want to spend too much more time. We're gonna give you some free time, and I'll do that during committee. We'll find that there'll be days where we have these little blank spaces, but we need those, and you'll get some free time to do work. Then there'll be days where we just go right up until the bell rings to go on the floor. And that is going to be legislative time and life. No apologies for that. If you guys need to take a break, just get up and take a break. If there are days when I'll say we're taking a 5-minute break, that means a 5-minute break, and we know it expands to 10, but that's why I'm careful about our time, but there may be days when we take breaks. And we'll have folks who you'll meet who represent different organizations. For example, we'll have someone who represents Vermont Care Partners, which are all of the counseling agencies around the state, and will represent their interests. And so they'll come in and someone will come in and talk with you about how the workforce is really devastating right now for counseling agencies, and the salaries are so low, we can't hold on to people. So that becomes an issue for us in here. And it becomes an issue in here, and it travels down the hall to appropriations, and how can we fix that? So last year we did a 3% increase in did we do it last year for our
You came across the hall because we
Yes.
need money.
that's right, we need the money to do the work.
So finance raised some insurance broker fees paid by the national insurance companies.
Oh.
False
Mistake.
alarm,
I hope it's a mistake.
testing us.
Okay,
They usually tell us.
yeah. That's the alarm for leaving the building.
We should probably lock the door to be safe, right? Isn't that the protocol?
that.
What?
Isn't that the protocol? Lock the door?
Well, usually they
Yeah, but
come
it's
on
not.
and say
That's
it's a
the
public,
fire alarm.
public safety alert.
Kiki, you want to
And
find out?
yeah,
Yeah,
last year we did have a real fire.
so
Smoke in the kitchen.
anyway, so there will be a number of folks who contact you, and they're all desperate for their own interests, and we're all desperate for their own interests. If we could give everyone everything they needed, I would be personally very happy that we could help the folks we need to, but we're within constraints, and the constraints land down in appropriations. And I sit on appropriations, so I can carry the information. And finance, we've got the two strings down to finance, and Senator Hardy is also on finance. She's got good background in this area, so we'll have some of those connections. Just to let you know, for me, the session last year never ended, and I've been working very hard, meeting weekly with what you all know as Act 167, the hospital transformation piece. And part of the hospital transformation is linking hospital acute care with community care services and other social determinants of health, like transportation, etc.
Can we get a one-on-one on that?
And
That's
so
my-
one of the things I was going to say is on the agenda for next week, maybe the week after, is an update from the Green Mountain Care Board, Owen Foster and Jenny Samuelson from AHS, to talk about where we are with that and what that means. And I continue to meet with them. And we'll talk about the report that came out, and there are some bills that will fall out of that report that are less intrusive and actually may be helpful. So we'll see some bills on CON. We may see some other bills. CON, you'll learn
Yeah,
about.
yes, what is CO?
Okay. Acronym 101.
Yeah.
So we'll talk about that another time. I don't need to get into the detail, but we will be going into that. And I will share with you my overall goal. And I'm telling people this because I think it's really important that we start to think about it together. My goal is to look at payment and how we pay for healthcare services, because within that is the cost. And we know that the costs are doing this, right? Excel.
May I have your attention, please? May I have your attention, please?